flexion, extension, rotation. What's the other one? Lateral. Yep, and we'll breeze right through these. And the rest of the weekend, tomorrow, you'll be doing posture. And there's different ways we look at posture. We're going to hang some lines that are called plumb lines, and then you're going to be responsible to kind of know, we can critique everybody's posture. So what's going on at the shoulders, what's going on at the head, what's going on at the hips, the feet, the knees. And this is important out in practice, because if someone has some sort of postural imbalance, it's obviously probably going to affect some sort of movement or some sort of daily task. Or they might have compensated so long that, you know, they just live with it. But definitely want you guys to be able to observe postural imbalances, because it's important. And I'm sure you've noticed that with the cell phone age, this is how we are. So in a few years, we're all going to have, not all of us, but when we look on our cell phones, we're always like this. So what are my shoulders doing? They're hunched, right? They're rounded. We want a nice fit. So if you're on your phone, try to remember to stay erect. Up here.
I see everyone.
Yes.
I see everyone. Everyone.
Well, you were like this. Should probably get some glasses then. All right, guys. All right, let's go. Okay, so first one we're going to do is flexion and extension. Okay, so for me, I'd rather have her eye level. That's why I don't want to be down in the chair. But your access is going to be placed over the external auditory meatus, or the earlobe. So earlobe, your stationary arm is going to be perpendicular to the floor, and your movable arm is following along your patient's nares, or the edge of their nose. Okay, so can you bring your chin to your chest, please? So you're starting at 90 degrees. Remember how we started the hip at 90? Is that all you got? Good. You okay? Relax. I got 45 degrees. All right, same thing, let's do extension. So we'll align my landmarks, external auditory natus, which is your earlobe, and then your stationary arm is perpendicular to the floor, your movable arm is following along your patient's nares or the edge of the nose. You bring your chin to the ceiling. Good Lord. It is hard with the mask. I will not know why. Wow. That's all you got?
There's more.
That's insane. 70 degrees.
Oh, look at what's normal.
45.
45 is normal for both of those.
You're welcome.
Would you get lots of the best?
Yeah, and I don't think she was. I think she had good posture, and I don't think she was trying to compensate. Let me see you do it without measuring. Just
Oh my God, wow.
and then see your chest. Very nice.
Before we go any further, you guys listen up. Before we go any further, let Dr. Pignon tell you what she does with cervical range of motion at her job.
So I do cervical motions pretty much every day because I deal with babies, and a lot of babies that are in the NICU have torticollis. Do you guys know what torticollis is? So what it is, it's shortening of the ligaments. And a lot of the times the babies that spend several weeks in the NICU, they lay in a crib, and as much as we can try to get them up and do tummy time and all that stuff, a lot of the times they don't have the muscle strength to maintain their head in midline, so what they're doing is kind of like this. So a lot of the times they get a lot of neck tightness and all that stuff. So my job, our job as therapists, is to make sure they don't go home with that tightness. But sometimes it happens in utero. It's no big deal, but they do end up having severes where it's a head tilt, and term kiddos can have this too. It's not just a preemie issue. So I literally measure and stretch babies with cervical motions every single day. So if you're going to go into peds and you're going to work with that population and infants, then you'll be dealing with a lot of torticollis.
I thought it was important for you guys to understand, because a lot of people are like, well, cervical, that's PT. But we were talking about, Dr. Pignon and I were talking about it yesterday, and she was telling me some of the things that she does. And I thought that would be a really good way for you guys to understand that, yes, we do have some crossover between OT and PT. I do cervical screens in the hand therapy clinic, and I also do a little bit of compression at the neck. There's some specific maneuvers that you do, specific positionings of the head to test to see if their nerve issues in their hand are coming from the cervical area. Okay? I don't necessarily take range of motion measurements. I grossly look at it. Can you look over each shoulder, ears to the shoulder, head down, head back? And then I'll even ask them in some of the positions, do you have an increase in your symptoms? Is it on the right or is it on the left? Then if there is something coming from the cervical spine, I generally tend to refer them back to their physician for possible MRI or physical therapy. So this is something that you might see. Whereas when we were talking about the lower extremity, it's real gross. You may not see a lot of that in your clinics. This you might actually start to utilize. And even in the COMT, the certification of manual therapy, for the OT, cervical areas in there. Okay?
I think it's important too in the adult population. So say someone suffered a stroke, right, and they're lying in their hospital bed and you notice that they don't have any cervical motion, and unfortunately they've been stuck for days like this because nursing, it's not that they don't want to move them, it's just they don't have the knowledge, like, okay, we should probably see if we can get a little bit of motion. And I'm sure that's very uncomfortable for someone who can't communicate that, hey, I've had, this issue of having trouble communicating right now. So I think it's really good to look at the whole body and see what we can do to help with positioning, to help with comfort, and there's no reason why you couldn't give a client some exercises for some lateral stretching or some rotation, right? Want me to keep going? There's 3, or do you want to keep going? Okay, so the next one would be rotation. So you're gonna have to get at the top of the head, okay?
I guess yes.
You wanna come do it then? Alright, so the axis is gonna be placed on the center of the top of the head. The stationary arm is gonna be parallel to the floor, and the movable arm is gonna follow along our little nosy, little hangers. So we're gonna do both left and right. Can you bring your head to the left? Is that all you got? Okay, good. 50 degrees. Right. Can you go the other way? Go ahead. Is that all you got? Well, you have more on that side. Please. 70 degrees, 71. Are you right-handed?
Yeah.
All right. Last one we're going to do is lateral. So the axis for the lateral, right and left flexion is going to be C7. How do you find C7? You guys remember?
Most prominent.
What?
Prominence.
Yes, very good. So axis is placed over C7. The movable arm follows along the midline of the back of the head. The stationary arm is going to be perpendicular to the floor. Can you bring your left ear to your shoulder, please? Is that all you got? You sure?
Bad lateral bending.
35 degrees. Right. About your right ear to your other shoulder. Is that all you got? 42 degrees. So always more on your right for everything.
So what could be a compensatory motion that you want to watch out for this?
Shoulder raising.
You also turn it. You'll see, put your ear down to your shoulder and people turn their nose that way. Okay? So you want to make sure when their head is straight forward and their ear truly is just coming down to their shoulder. Okay? The other way that they measure a lot of these is actually by taking a measuring tape. We like the goniometer way. I just feel like you guys need to be working on the goniometer, and it's just I think it's a more accurate way.
So to review flexion and extension, your access is going to be at the earlobe, and you're going to start at 90. For rotation, you're going to be at the top of the head, and for lateral, right and left, you're going to be at the C7. Okay? Let's work on it.
Rotation, the stationary arm, does it matter when, as long as we start it?
For me, it doesn't matter, but I think it had it switched up there, because as long as you're following. So the edge of the nose, you want the movable arm.
And the
So
stationary arm?
you could have it here, you could have it here. It doesn't matter.
What was that question? I'm sorry.
Rotation, where the stationary is.
Okay, because I think up here is straight.
Stationary. I got it. Let's work on it.
So the range of motion for your cervical spine will come from Clarkson, right?
Yes.
Clarkson, okay. And then your postural assessment will, it will be from your text, your Lippert text. It's all in there. Okay, posture is chapter 21. Now when we are assessing posture, we're actually looking at the alignment of the entire body. We are looking at the head, the shoulders, the spine, your hips, knees, and your ankle. Okay, so we are using what we call a plumb line. Your plumb line is a string that is suspended, like what we have there. It has to be straight and weighted, because that represents the line of gravity. So the position of your plumb line will tell you if your patient is standing upright, or do they have any postural deviations. So we look at posture from the side, from the front, from the back. From the side, your plumb line should go through the earlobe, your acromion process, the greater throat, the patella, and your lateral malleolus. You're over there, you'll be my person. So what you want to do with the plumb line on the floor, that's where your person's going to stand. So because I have the lateral view up, I'm going to have her face this way. Then I will see, is the plumb line in line with her earlobe? Is it in line with her acromion? Is this in line with her greater throat? Right here. Is it in line with her patella and with her lateral malleolus? So just look straight. What do you guys think? What are you seeing?
Pretty good.
Yeah? So yeah, she's standing up straight. Some of you will have their neck forward like this. Others will have their shoulders rounded. So what we want you guys to write down is, tell us where the plumb line should be and what you're observing in your partner. So your assignments, you guys are working in groups, right? You can just have one picture, okay? But we would like to have different pictures in the slides. You can't just take her picture and that's what the whole class is going to use, okay? Actually, I think I can use this slide.
Sorry guys. Did any of you lift the computer?
You Now, yep. You just want it, you just want your partner to stand facing the plumb line this time. What you're looking for is symmetry. Are her shoulders in the same level? Are her hips the same level? Are her kneecaps pointing forward, or is it are her legs bowed so that the kneecaps are facing each other? Okay. Is there space between her legs, and are her toes facing forward, or does she tend to rotate one foot outwards? Okay. So that's what you are looking for in the anterior view. Again, this is outlined in Lippert. Okay, tell us what the book says and what you're seeing. Now, we will also do posterior view, turn around. Okay, so the same thing. You are again looking for symmetry. Now, this time, you want to see if her neck is rotated or bent this way, if her shoulder blades are uneven, and if her pelvis is uneven or even. Okay, so it's there in your text. We will spend a few minutes so you guys can take pictures of each other and work on your slides. Do you have any questions? Yes.
For like practical purposes, what would you want us to like say when we're doing it? Would we say
Yes. So with the practical exam, we will do cervical range of motion, and then we will have these plumb lines up again, and we will just ask you guys to describe posture, if it's lateral, anterior, or posterior view.
For the most part, when you said make sure there's room between the lines, is that like for bow leg or
Yeah.
kind of things? Should we roll up our pants for the picture?
Say
Should
that.
we roll up our pants for the picture? Or if you've got your shorts with you?
Yeah. Yeah. So roll up your pants, or if you got shorts, you can change.
And for right now, probably the best thing to do is just take the picture, decide who's going to do it, who's going to take a picture, who's going to stand there, and take your 3 views. And then you guys can analyze it later, okay?
Okay, there any questions? Okay, so you guys, there's 2 here.